Well, getting tested is the right thing to do, and it's a treatable disease. For now, we want to ensure that you have a safe pregnancy and a healthy baby.
All right, thank you.
Okay, so that was an optimized version. Be happy to open it up for a couple of minutes of discussion about what could even be done further, or what did people like about the second one, where there's even more room for improvement.
Hi there, this is Susan. I was thinking it's usually helpful to provide something printed too. I'll give you something printed regarding what we talked about, because sometimes, we talk about so many things during the visit. It'd be helpful to have something to refer to later.
So yeah, knowing what resources we can kind of give the patient to reassure them. What additional testing, based on what we covered today, would you recommend for this patient at that test? Okay, Brianna, great, thank you for writing in. So yes, you want to check your e-antigen test and your DNA test. LFTs, yes, thanks Brianna. Have you heard of elastography? What elastography tests? Is it in the form of FibroScan or MRE?
This is Katie. In Philadelphia, we have to refer. We have two, and we have to get a prior auth through the patient's insurance and then send them. And we don't have a lot of success unless someone's a little bit higher functioning, but it takes a little, we can get it done if we have to, but it's not for everybody.
Katie, are there other tests sometimes you think about if you can't get it authorized, or other ways you try to do a fibrosis assessment?
We just use the serum F scores.
Okay. So
the other thing that I've done for uninsured patients is calculate the API, because if you don't, that can be an estimate if they have cirrhosis or not.
Yeah, so have people heard about the OPRI test? Let me actually see if I can stop sharing and go to some of these web-based resources. Katie, you just mentioned the OPRI calculator, right? So, and what's nice about these calculators is that some of these are just generalized calculators that can be used for liver disease. So APRI is the AST to platelet ratio index. Yes, and Julie made a comment here for the whole group to see some places have ultrasound with elastography reading. That is correct. So some radiology facilities are.
Beside the case that you presented, by the way, the talk was great. If the person is co-infected with HIV or even Hep C, would that change your management in terms of interpreting the tests, vaccination, screening, be more vigilant for HCC?
So that is an excellent question. So
I know there's some literature that says that having a core antibody positive but not mounting the surface antibody response is more common in HIV positive folks, and I wanted to see if you could speak to that.
Typically will not mount as robust of a response if you have another condition that's impacting your immune system. Thanks again so much for sending in a case.
Yes, thank you.
I'm not sure if it's that exciting, but I can certainly talk about it.
Yeah, I would love to talk about it. And like I said, I think one of the tenets for the ECHO model is very much built on case-based learning. So it really depends on our learners bringing up cases so that we can talk about it. So, okay, so let's start here. Katie, do you want to walk us through this case?
Sure. This is a 50-year-old co-infected patient with hepatitis B and HIV who I've been following for probably 15 years.
What are the things that put the infant at risk for mother-to-child transmission here? What are the things that are standing out to you?
Her high viral load. She's e-antigen positive.
Right. So, and she's at 32 weeks. So this is definitely the right time to be being very. So Taryn, you want to walk us through this case?
Yeah, sure. So this gentleman, I thought his case was kind of interesting. So this is kind of a middle-aged African-American male born here, slightly overweight with his BMI of 31.5. But essentially he came to me because he had this, as a new case of Hep B, he had this Hep B surface antigen positive.
I just say it's been really great, and I really enjoyed getting to know all of you. You have my contact information. If I can be of any help, feel free to reach out at any time.
Thank you so much, Ponni.